Polymyalgia rheumatica is a condition with bilateral joint pain where the shoulders can be incredibly disabling and painful. It's a horrible condition, and there's only one drug that really helps called prednisone. Hi, I'm Dr. Megan, and I'm the prednisone pharmacist. I'm here to help explain polymyalgia, the treatments, the diagnosis, and what you can do so that it doesn't feel so awful for you. So, what in the world is polymyalgia rheumatica? Well, I've read this book and the guidelines written by the American College of Rheumatology and the European League Against Rheumatism. There are 7 hallmark symptoms of PMR to make sure that it's not something else, to make sure it's not rheumatoid arthritis or another disease. They have 7 things that they think are unique to PMR when combined together. Okay. So the first thing in this book on the 7 hallmarks is over the age of 50. If you're over the age of 50, then it's more likely to be PMR than something else. If you're under 50, then it might be another condition and they need to rule it out. PMR is a diagnosis of exclusion. They have to make sure that it's not one of the many other things that look kind of like it. And then number 2 is that symptoms last 2 weeks or more. So these symptoms are horrible and they make it so people can't function very well. Number 3, that there must be aching or swelling or pain on both sides. So both shoulders or both hips, the pelvic girdle. And it has to last 2 weeks or longer. And so this swelling, this pain, this inflammation makes it so that when a person wakes up in the morning, there's incredible pain. You might just, oh, it hurts. Not be able to pull yourself out of bed because the shoulders aren't working. You might not be able to drink, to use a cup, to lift up to your mouth, to use, a spoon or a fork. If you're a woman, you might not be able to put your shoulders backwards in order to latch your bra. Things like that are really hard for people with PMR because the shoulder is in such incredible inflammation and pain. Number 4 is that this morning stiffness must last 45 minutes or longer. And so it's not just, oh, it hurts, and then you're able to get out of bed and function. It's nearly an hour of disabling pain. And like I said, PMR is a diagnosis of exclusion. So they're going to do a lot of blood tests to make sure it's not something else. One of those blood tests is number 5, elevated ESR. They want to make sure that your blood tests are showing high inflammation. So ESR stands for erythrocyte sedimentation rate. They want to make sure that that number is high because that means there is inflammation somewhere, probably your shoulder area, causing this number to go high. And then number 6 is an elevated CRP or C-reactive protein. It's another blood test showing inflammation. And when both of those are both showing high, there's a lot of inflammation going on somewhere. So number 7 is that when prednisone is taken, this is an anti-inflammatory drug. With all that inflammation, that there's a rapid response to the prednisone. For some people, they'll say within 2 hours, I went from feeling like an old man to, oh my goodness, I can raise my own arm, I can get dressed, I can put my own clothes on, I can eat, I can play tennis, I can do the things that I couldn't do before. And it's rapid. Some people it's not 2 hours, some people it's 2 days, but there is a definite response to prednisone. And a noticeable lack of response to other medications like ibuprofen or Tylenol, Motrin, Voltaren, all these non-steroidal anti-inflammatories, don't touch it. They seem to have no effect on that kind of inflammation. Only the prednisone and other steroids seem to help. And prednisone seems to be the most widely used medication for PMR. If you're not in the United States, it might be prednisone's sister drug, prednisolone, with a little OL in the middle. It's possible you could use hydrocortisone or dexamethasone, but those are much less widely used. And so what kind of a dose of prednisone would a person with PMR get? Well, this is prednisone 20 milligrams. This is on the higher end, and 10 milligrams and below, definitely 7.5 milligrams and below is considered low. And the dose that is often given for PMR of prednisone is somewhere between 12.5 and 25 milligrams. So it's in the mid to higher range of doses of prednisone. And what they want to see is if they give you this much of the medication, are you responding rapidly? And if you are, then that's a sign that, okay, this is PMR, let's treat it. But if you do respond, that means you're going to be on prednisone for a long time. Most people who take prednisone are taking it for other conditions, such as allergies or asthma, and they might need it for a week, 5 days, maybe 3 weeks. But for people with PMR, it might be 6 months, a year, or even 3 years of treatment with prednisone. The goal of treatment is to help you function, is to help you be able to get out of bed in the morning and do your normal life. And finding the best dose for you is the trickiest part of the PMR treatment, because we want to find a dose that is going to keep that inflammation at bay and allow you to move, but we also want to minimize your exposure to the drug as much as possible because there are so many side effects. So it's a really tricky dance you're going to be playing for the next while, finding the lowest effective dose that you can take. And so it's going to be somewhere between 12.5 and 25 milligrams. Often they will start at 25 and then slowly taper. And then it's usually somewhere below 12.5, around 10 milligrams, where people with PMR really struggle to taper any further. They'll tell me that they got to 10 and then it all flared up and they had to go back up again. And so the tapering is really tricky. There's a really great website I can show you that has different tapering strategies of ways you can taper off. I have a printable taper chart, but essentially you want to get down to below 15 milligrams and then go really slowly after that point, whether that's 1 milligram a month or a half milligram a month. At that point, it's a really tough situation. And often people work with their doctor to get different strengths of prednisone. They start out maybe with a 20 milligram, but then they'll get a 10 milligram, a 5 milligram, and a 1 milligram so that they can work out what that exact dose is themselves. And not everyone is given that opportunity, but often doctors will say, okay, we got you to this point, and now I'm going to let you listen to your body and find a way to taper from here. And so you might be on 10 milligrams for a week, and then the next week you take 9 milligrams for Monday, Wednesday, and Friday. And then the following week you do it 5 days, and you just slowly go down by 1 milligram. Maybe even slower than that. Maybe only one day out of the week you're down 1 milligram. It really depends. And so check out that website, see what tapering options they have. And now, what side effects would you be looking for? Which side effects should you be afraid of with prednisone? Well, I personally had to take prednisone for a different autoimmune condition, and I had to take it for 8 to 9 months, and it was miserable. I gained weight. I got a big round moon face. I lost muscle mass in my arms and my legs. I lost bone mass. And so I was increasing my risk for osteoporosis and fractures. Another sign of that is losing height by the bones in your spine compressing on each other. Osteoporosis. I had mood swings. I felt cranky around my family. I had insomnia. I had little shaky feelings. I had so many miserable side effects. And so it's really hard to want to continue taking the prednisone because it feels so awful. But the PMR feels worse, right? And so finding that balance of, okay, my PMR is under control and I'm taking the lowest effective dose that's keeping me in balance is really tricky. So are there any alternatives you could take to prednisone? We've already mentioned you don't want to try ibuprofen or Tylenol. Those don't work. Are there any prescription treatments? Well, I mean, other steroids could help, but is there anything else? Well, recently, the FDA has approved a few biologic treatments for people who have the diagnosis of PMR. And now these are not perfect. These are not slam dunk. If they were, no one would take prednisone ever again. And they are also very expensive. So these are called IL-6 or interleukin-6 inhibitors. And the first one approved was Actemra. and it was originally approved for rheumatoid arthritis. And then the second one that was recently approved is Kevzara, which is also sarilumab, and then the Actemra is tocilizumab. And so these monoclonal antibodies, they're injectable and they block a signal in your body that is responsible for inflammation. That's the IL-6. The problem is they can increase risk for infections. Prednisone also increases your risk for infections. And so they come with their own list of side effects. When they compared Kevzara to placebo, so like no treatment versus Kevzara, and they wanted to see who was in remission. And Kevzara got 28% of people into remission, and prednisone got 10% of people into remission. So 3 times more people, but it's not like it was 100%. It was only 28%. And it just doesn't work that well, and it does cause more side effects. Like people complained of tons of side effects with it too. And what about Actemra? So Actemra, like I said, was the first one approved. And when they compared prednisone to Actemra or tocilizumab, they found that 63% of people who take Actemra got to be in steroid-free remission versus 12% of people who were taking prednisone got into remission from PMR. So it does seem to work better than Kevzara, but still, 63% is not 100%. And it does come with its own side effects. So there's no perfect answer when it comes to these alternative medications for PMR. Which ones should we definitely not use? The doctors said definitely do not try other medications instantly. They want you to start out with the prednisone. So if prednisone is terrible and it doesn't seem to be working that well, after a while you could add on something called methotrexate and it might help. But again, it's not that effective. Because prednisone is so harmful, they want people to be doing exercise to help counteract the side effects. And so if you possibly can, do muscle strengthening and bone strengthening exercise as well on prednisone. There's also a lot of other things you can do to counteract the side effects of prednisone. And I include those in my prednisone checklist. I'm trying to help you find the right balance between the benefits of it helping you function and getting the side effects to be as minimal as possible. So I created a prednisone checklist, and it goes through the things you need to follow up with, whether it's for your bones or your eyes or your muscles or your heart, to make sure that the benefits are outweighing the risks for you. And then I also go through the top 7 mistakes that people often make when taking prednisone. I don't want you to have to make those mistakes. So download my prednisone checklist now, and then you won't have to make those mistakes, and you'll know exactly what you need to follow up while you're taking medications like prednisone. Signing off as Dr. Megan, your prednisone pharmacist.